We started discussions about this project well over a year ago that involved multiple team members. Again, feedback from the community. We've gotten feedback from patients, like what are you looking for? We've had tours of other facilities to see how the flow of their patients worked.
We've spent a lot of time and energy in planning and preparing for this. Once we received the grant funding, and then efforts went prior to the grant, receiving it, planning, implementation of different things, there's a whole lot of moving parts. We wanted to make sure that we're providing the optimal care to our community. We wanted to make sure efficiency, cost effective. There was so much planning that went into making this project come to fruition.
So a lot of time and effort has been put in, prior to our groundbreaking, and we wanted that to be the case because, again, we do want the actual construction and renovation to move forward relatively quickly. We do have a high utilized emergency room. We understand that we are a small community, but our emergency room stays very busy. And we want to do the best we possibly can to take care of these patients as quickly as possible.
We're able to implement what we're going to call the lower acuity treatment area, which is much the same. You're still being seen by the same providers, the same nurses, just the area is changing.
We are building a kind of a fast track area where when you come in and your ailment can be treated quickly. Instead of you being in the back of the emergency room tied up for hours at a time, we're trying to dedicate a space to moving patients in, getting them to see a provider, get their medications and their prescriptions, and get out of the door in a more timely fashion.
That way we can provide optimal care to those high acuity patients experiencing that worst day of their life, and then still provide the same great coverage of care to those patients with lower acuities. Be the same process when patients come to the emergency department. They would first be registered, triaged, and then the nurse would determine this patient goes to the emergency department, to the regular rooms people are used to coming to, or they will go to the lower acuity treatment areas.
We strive, and our staff strives, to give the best possible care. They want to have that opportunity to have that personal care, that high quality care with their patients. So I feel like our staff is really engaged and they're really excited, to have that new space to care for the patients. And so just to know that they know that Emanuel is putting their money into changing things for the better for the patients and for the better for them.